So shoulder replacement is an operation that is done to help treat patients with painful shoulders when they've exhausted all kinds of non-operative interventions. It generally involves resurfacing the lining of the joint on both the ball and the socket side using an artificial implant made either of plastic, a ceramic, or a metal. This is an operation that's done by some specialist surgeons. It's an extremely good operation for the right patient, as it does make a huge difference to their function. But it is a major operation. It's not something that should be taken without having had a proper consultation with your clinician, going through the options, and your surgeon will most likely have arranged for you to have had further imaging performed to help decide how to plan the operation as well. If you were to then proceed surgery, it would involve going to have an anaesthetic assessment. The day of surgery itself, you would be given an option of either a general anaesthetic or a regional block to down the arm. You'd usually have an operation down the front of the shoulder, which will go from around about the top of the collarbone down the side of the arm. And the operation then is closed. At the end of the operation, you'll have a dressing applied over the stitches. You'll be given a polysling, and then you'll be coming to an anaesthetic recovery area before you go back to the ward. Shoulder replacement surgery is performed for a number of different reasons. Predominantly in this day and age, as people are more and more active as they age, it's for people who have arthritis, which is very painful. They generally are unable to do the things they want to do. They've usually tried physiotherapy, they've usually tried injection therapy, they've tried modifying their activities, and they're just not coping with the symptoms that they have, predominantly discomfort and often lack of movement in the shoulders. So we offer it for those patients who we think are good candidates for surgery, that we think that their function will be helped by having the pain from the arthritis taken away. And we know that in the right patient, you can potentially achieve what we call a silent shoulder. In other words, apart from the scar from the surgery, you may not even know you've had it replaced. So in the right patient, it is an absolutely life-changing operation. There are several different types of shoulder replacements. In very simplistic terms, they are divided into what we call anatomic total shoulder replacements, which means, as the name suggests, you try and restore the original anatomy, but replacing the worn-out surfaces. And these rely on the shoulder's normal muscles and normal tendons to move the shoulder as normally as possible. There is actually, though, another type of shoulder replacement that's far more commonly used in our older patient group who are perhaps less functionally demanding, called reverse shoulder replacement. And a reverse shoulder replacement is called a reverse shoulder replacement because the orientation of the implants is reversed to what Mother Nature designed. So the ball goes where the socket is and the socket goes where the ball is. So in essence, you're actually doing a non-anatomical operation. And this is something that's offered for patients who tend to suffer from conditions such as a rotator cuff arthropathy, where the underlying tendons of the rotator cuff are damaged and not repairable. The advantage of doing the reverse shoulder replacement is that the body is very clever and it can be trained to work in a way different to what it was originally designed to do. And effectively, you can rob Peter to pay Paul to get some function back. It's an excellent operation for pain relief. It's a very good way of getting some function back for patients who may have what we call a pseudo-paralytic shoulder, whereby they literally can barely move their shoulders at all. And it's an extremely satisfying operation. It is, however, very complex, and there is a very high complication ratio, so you should be looking to see surgeons who do high numbers of these and have follow their own outcomes, and quite often they will have asked you to fill out a questionnaire to assess your, what we call the patient-reported outcome measure scores, or PROMs, so that we can assess our performance, as this is a relatively newer procedure compared to hips and knee replacements, for example, so we don't really know what the long 25 or 30-year follow-up will be. But at the moment, certainly the early indications are that it's an excellent operation, and the right patient in the right hands can be, again, an absolutely life-changing intervention. The actual surgical procedure itself takes about 2 hours, what we call skin to skin, from the time of making the primary incision to closing the skin. In practice, if you're the patient going down, you'll probably be in the anaesthetic before that, and you'll come around in the recovery afterwards. So I'd expect about 3 or 4 hours between the time you left the ward, the time you return to the wards, depending on where you go for your procedure. Some patients, this can be much, much quicker. You have very straightforward anatomy. In other patients, where they have more complex anatomy, it can sometimes take longer. To try and mitigate against this now, in some patients, we actually try and get patient-specific implants and jigs designed to help us put the implants and the components in the correct place. This is very useful for a number of reasons. It helps to make sure the surgical time is quicker, to take some of the guesswork out. and also it helps with giving a more reproducible and reliable result. As a result, I think that's probably the way forward for many of our patients in the future. Recovery depends on what kind of operation you've had and what your functional expectations are. In practice, I tell patients that the first couple of weeks you'll have to keep your wounds dry until your sutures are removed. There's a saying that boats can swim but they can't jump, so to minimise the risk of infection, you look after the wound. So as you're getting back to full function, we normally say about 6 months to get back to your full function with both, with an anatomical shoulder replacement, and actually we know there's good evidence that suggests it can take up to 9 months to be able to retrain the shoulder muscles to work in a slightly different manner required for a reverse shoulder replacement. So I always tell patients who think they may not be progressing as quickly as they would like that it's a long process. It's a bit like having a baby. So you can't expect to be perfect straight away, but the end result is hopefully worth waiting for.